Come in.
Hi. Hi, I'm Janet. I'm your transition coach.
I'm Patricia.
Hi, Patricia. Nice to meet you.
This is Betsy, my granddaughter.
Hi, Betsy. Nice to meet you
as well. What's a transition coach?
That's an excellent question. So a transition coach is part of this hospital-run program we have called the Care Transitions Program. And it's a program designed to assist you with your transition and really empower you as a patient we're trying to promote a more active role from the patient's perspective. So I want to make your transition from the hospital to home go as smooth as possible.
Well, that sounds like a good idea, because last time I was discharged, I took the wrong dose of my medication and I had to come back to the hospital.
Oh my gosh.
I was not happy.
I'm so sorry to hear that. I'm here to prevent something like that from happening in the future. So I'm going to help you I'm going to teach you about your medications, help you keep track of your upcoming appointments, teach you about the signs and symptoms of your condition getting worse, and then any undesired side effects of your medication.
So I'll be working with you?
You will, yes indeed.
Okay, then this will stop me so I don't have to come back to the hospital again.
Yes, that is the goal. That is the goal. So do you have any family members you want included? I know Betsy's here.
Betsy's in charge of everything because I'm old, I forget.
Okay, I'm so glad you're here, Betsy. It's really nice to have another person to look after and things like this. So, that sounds great. Are you ready to get started?
Yeah, let's do it.
Okay, excellent. So, you were admitted to the hospital because you had a heart attack and you have hypertension. Do you know what a heart attack is?
I know I had a blockage and they had to do bypass to restore the blood flow.
Yep, so they restored the blood flow to your heart. So since this has happened, you're going to be on certain medications for the rest of your life to prevent something like this from happening in the future. One of these is metoprolol, also called Lopressor.
I have it on my list here that I always keep with me. I've been taking 100 milligrams twice every day.
Okay, excellent. Do you know how this drug works?
No, I just take it because they tell me to and it's on my list.
Okay, so we want you to understand how this drug works. It's considered a beta blocker, and it reduces stimulation of some of the receptors in your heart called the beta-1 adrenergic receptors. In simpler terms, this means that it decreases the work of your heart so that your blood pressure and your heart rate go down.
So all that fancy stuff means that my heart doesn't have to work as hard?
Exactly, yes.
Okay.
And it's really important that you take this drug as directed, even if you're feeling good.
And what about side effects?
I'm glad you asked that question. So sometimes this drug can lower your heart rate too much. This is called bradycardia. It can also cause you to feel weak or fatigued. It can cause pulmonary edema, which is when fluid builds up around your lungs. So these are all possible side effects.
How will I know if there's fluid around my lungs?
So it'll be hard to breathe. You might feel anxious. You might look pale or have shortness of breath, especially when you're lying down flat. And these are very serious. So if this happens, you should contact your primary care practitioner immediately.
Thank you so much for letting me know. I'll definitely call them right away. I see my grandma going through any of this.
Great, thank you, Betsy. So, let's go over the rest of your medications. All right, so let's go through the discharge preparation checklist.
Do I have one of those? Do I have one of those?
You do. So we're going to give you this list, and there's a series of points on this list that will help determine if you're prepared enough to discharge. We want you to have enough information about what to do in case of an emergency. We want to make sure you understand your medications, know when your next appointment with your doctor is, things of this nature.
Okay, that sounds like a good idea. Let's go through that.
Yeah, okay, great. Let's go through it.